pharmacist about those side effects. You can talk to your pharmacist, as you go to pick up that medication. Hi, I'm starting this new medication. What are some things that I need to expect, or that I can keep in mind, or that I know of to track down for that when I do have that conversation with my doctor, that, hey, I've already touched base with my pharmacist regarding this, and now what are my next steps? So that's firstly though what I would tell you. Now, in regards to what you should feel on Salmonello, that I would have to defer to AstraZeneca, or because I don't want to provide any personal medical advice to you, and I don't want to overstate what that clinical data looks like, and overpromise things.
Well, that's the problem. They tell you what you're going to get, but they don't tell you how to cure it. I mean, I've been taking Salmonello for infusions for 4 months. I don't know whether I'm better or not, because my hands are still killing me. I get electric shocks. My legs are the same, and I'm trying to keep off prednisone because they tell you not to take it. And the first infusion that I ever had, I was in such pain. And when I called my doctor, he told me to take 3 prednisone. And since I've been on the Salmonello before, I try not to take it, even though my hands are in pain and I can't walk. So well, if nobody talks to you, how are you going to know?
Yeah.
That's the reason why I came to this thing today.
Yeah.
Because you can't talk to anybody, and I've learned a lot of things talking to people today.
Yeah, I'm sorry to hear that, because, for you to have to feel like you have to come here to get answers about your health, really, that speaks very poorly of your provider. I'm on
my third doctor, and I'm looking for another.
Oh, goodness.
You know what? After the panel, meet me outside. We'll discuss, and I'll try the best to point you the right direction of where to get those answers. Does that help?
Yes, it does.
I got a lot of voice I can speak.
Alrighty then.
I've been here all day, and I've heard a lot of comments about medication.
Yeah.
And, excuse me, I'm a little emotional.
That's alright, it's alright.
I also have an immune disease. I'm a type 1 diabetic. My wife has been diagnosed with lupus.
Take your time.
It's one of the coolest things I've seen someone go through.
Yes.
It manifests itself so viciously every day. I've heard about medication, talking to the doctors, having better doctor's knowledge. But I'm sick and tired of going in there and hearing the doctor tell my wife, this is just how it goes. You're sick for a day and it turns into a week. It's been 10 years. Good luck with another 10. I want to know, is there anything on the horizon that I'm going to get to a point where I walk into the doctor's office and I don't hear that. I don't hear this is just how it goes. This is the progression. I don't know what to tell you. I'm not even giving any more steroids. Every medication they give her makes her sick, makes it worse. Gives her vertigo, gives her seizures.
That's right. Yes.
I feel like half the time they don't know what they're doing.
Correct.
And they're giving me no hope.
Yeah.
And it's frustrating because I'm a rich man. I have no answers. And I have to look at her every day.
Yes.
And I get my help. And they dismiss her. They don't know, and it feels like half the time they don't care because they're frustrated because they don't have answers either.
I'm so sorry for that experience. Dr. Blum, you want to make your comments here?
Well, I'm sorry to hear that. I would say, not knowing the specifics of what's going on with you, what I would say more generally is you have lupus, and we know patients who have lupus tend to have lots of other things that piggyback with lupus. It's that monkey on your back, right? So patients can also have fibromyalgia. Patients can also have depression. Patients can also develop neuropathies. Patients can also develop sleep disorders. And, a rheumatologist may only address one or two of those things. I don't know. Of course, the medications you're mentioning, they have side effects. You mentioned seizures.
But I want to find out, are we getting to a point where my doctor or her doctor isn't just going to say that word? Is there any way to know that, like, oh, this one's doctor knows nothing, while others are experts? And say, are we getting to a point where these doctors are going to be routine information? When she walks in and they're not just going to look at her and say, oh, I'm sorry, I really don't know much, there's research, but, you know, good luck, this is just how it goes. I don't want to hear this is just how it goes anymore.
Can I go to our patient right there? And if you tell us, how do you deal with the situation? How do you make your voice heard and being part of the decision making?
Yeah, I definitely feel his comment. I'm also a type 1 diabetic now. It is a cruel disease. I think when you look at the logo for it, the P in the lupus is a question mark, and I think if I had to sum up lupus in a nutshell, it's that there's always more questions than there are answers. Like you talk to 10 people that have lupus, and everybody's is incredibly different.
Yes.
Like I've never had a single skin issue with my lupus. But my kidneys were failing, my lungs have struggled. The medicine, the Cytoxin that I did repeatedly over and over to save the kidneys gave me lymphoma. It's more chemo to fix the lymphoma, and the chemo is what gave you lymphoma. It's a whirlwind, and you feel like you're getting punched from every direction. But I will tell you that, you can't guarantee there's a fix, you can't guarantee there's a cure, but I can guarantee you that you can find a doctor who will listen and a team who will walk you through it. It took me 4 rheumatologists before I found one who would listen to me. Then that doctor retired. I got another one who wasn't really receptive to listen to my symptoms. I had to find a different one. I got this great job offer 6 months ago. I've been in remission for almost 2 years now, which I'm very thankful for. They told me I would never regain kidney function. My GFR was at 18, so essentially 18% function. They were putting me on the transplant list, talking to me about home dialysis because I wanted to still try and work. And it finally turned around. But even when I got this, life is going well, I got this great job offer, I was terrified to move from Houston to Philadelphia because I was terrified of starting over with new doctors. Terrified of going into an ER and an emergency room where they didn't have thousands of pages of files on me. They knew me really well at the hospital I was at, and they knew what my problems were. They knew how to treat me. They knew how to listen to me. So the only real encouragement I can give you today is kind of twofold. One, there are doctors out there. Wherever you live, find someone here today who can give you some good referrals. You've got to have the right doctor. It doesn't mean they'll fix it, but it means they'll be willing to try different things. It means they'll be willing to really listen to what you're going through and try different things. But then the second thing I would offer advice is, it can get better. I was at a point multiple times where I didn't think it was going to get better. You see me, I'm 6'5", right now I weigh about 205 pounds. I've weighed as much as 280. About 2 years ago when I came out of the hospital after a bowel surgery and lymphoma and 6 rounds of chemo, I weighed 148. I had to get a feeding tube to get back to the weight that I was at. Not a feeding tube, I had to have it through a port. I had to have nutrition. I'm in remission right now, but I know that's not a forever thing. So I do everything I can to the fullest right now, live life to the fullest. But also, there is a part you play in it. There are decisions you have to make on a daily basis where you got to do what's best for you, got to do what's best for your health. I think the reason they use the word warrior is it's a constant battle. It never goes away.
Yeah.
But I really feel your pain.
Thank you. I think we can get one more question before going to lunch. Do you want to go? Sorry.
Hi, thank you so much. Speaking of weight management, one thing that I know a lot of lupus patients deal with, whether it's from their disease state or mental health or the medications that they're taking, is a lot of weight gain, and then that increasing their inflammation, their joint pain, and all of those kinds of symptoms. With the advent of GLP-1s recently, what have you been seeing in your lupus patients with regards to the new weight management medications, how they potentially interact with the disease state, but also potentially with lupus medications?
Very good questions.
Yeah, so actually, thank you for that question, and I kind of like jumped into answering it because I happen to be one of the patients on a GLP-1, and it's GLP-1s, especially in the kidney world, are so exciting because just like lupus nephritis or other types of kidney disease, we really didn't have a lot of, disease therapies that would actually slow the progression of chronic kidney disease. And here comes GLP-1s, and we have majority of our patients with chronic kidney disease happen to have diabetes and